This podcast, a simple summary of a scientific peer-reviewed paper, is made with the help of AI by Big Head Pain, Dr. Faraidoon Haghdoost. Today's episode covers the paper, Comorbidities as Risk Factors for Migraine Onset, a systematic review and three-level meta-analysis, by Maria Terhart, published in the European Journal of Neurology in 2025. We often talk about conditions that occur with migraine, but this study looks at something more important: what comes before migraine. Could other illnesses or health conditions actually increase your chance of developing migraine later in life? To answer that, the authors performed a massive systematic review and meta-analysis. They looked at over 17,000 records and selected 38 studies that explored whether pre-existing health problems might predict migraine onset. These included a wide range of conditions: allergic disorders, mental health problems, sleep issues, cardiovascular diseases, and more. Using a three-level statistical model, the authors found a clear answer. Yes, some comorbidities significantly increase the risk of developing migraine. The strongest association was with psychiatric conditions. People with depression or anxiety had more than double the risk of developing migraine later. Some of this may be due to shared genetics. Recent studies have found overlapping genes between migraine and depression, and some due to external factors like chronic stress. Interestingly, the relationship is likely bidirectional. Migraine can lead to depression, and depression can also precede migraine. Sleep disorders also stood out. Insomnia and abnormal sleep duration were clearly linked to future migraine onset. Since the brain areas that regulate sleep, including the hypothalamus and brainstem, are also involved in pain control, this connection makes sense. People with allergic or so-called atopic diseases like asthma, allergic rhinitis, or eczema were also at higher risk. This might be explained by the role of inflammation. For example, immune cells like mast cells can release substances that irritate pain pathways in the brain. In some studies, kids who were treated for allergic conditions had fewer migraine attacks later in life. The last group showing a significant link was cardiovascular disease, including high blood pressure, coronary artery disease, and stroke. This is particularly interesting because we usually talk about migraine increasing cardiovascular risk, but this study shows it might go the other way too. Shared vascular mechanisms could be at play here. On the flip side, not all comorbidities predicted migraine. Metabolic and autoimmune conditions, like diabetes or psoriasis, did not show strong associations in this analysis. The big message is this: migraine might not come out of nowhere. Pre-existing mental health issues, sleep problems, allergic conditions, or cardiovascular disease could push the brain closer to becoming migraine-prone. Recognizing these links could help with early identification and even prevention. For clinicians, this means watching out for migraine in people with these comorbidities. For researchers, it offers a roadmap to better understand the early stages of migraine development. And for patients, it's a reminder that migraine is a complex condition deeply tied to the rest of the body.